Hi everyone, this is a brief lecture on evaluation. This and the material in your text that you're supposed to read on evaluation should help you with the assignments related to this lesson. So these are the reasons why programs are evaluated. They're evaluated to see if they're cost effective. This way, when there's budget constraints, people use specific equations to determine if one program is more cost effective than the other, and then decisions can be made based on that. What we're going to be doing is when we do evaluation in this class is to determine if your program was going to make a difference. We also look at evaluation for strategic planning, and strategic planning occurs when you use planning processes, which we're using in this class, and you can then evaluate the processes. And finally, sometimes we evaluate programs because we're looking to see how we add to the profession. Anytime you have a grant, all the work you do on the grant is published on the funder's website, and that is an example of a way to add to the profession. You also might evaluate your program and then present it at a conference. So there's 5 steps to the evaluation process: describing the program activity, which you've done, selecting evaluation measures, which you will do, designing data collection and analysis, and you will be designing 2 forms of data collection, developing an action plan, which you will do in your IE paper, and reporting results. You will not be able to report results in this class because we are not actually conducting the evaluation. You will, however, be able to evaluate results when you get to the 400 level classes. So I have this on the board right now because Precede-Proceed is one of the major models that are used to look at planning. And when you look at the model going across the top from right to left, there are phases of planning, there's implementation, and going across the bottom left to right is evaluation. And it looks like evaluation and planning actually occur separately, but when you get into the real world, they typically occur at the same time. While you're doing these 2 phases, you're also thinking about this type of outcome evaluation. When you're doing phases 2 and 3 and 4, you're actually doing process and impact evaluation planning. So in the class, we actually do them separately, going from right to left and then left to right. But in the real world, we actually do them simultaneously. So these are the 3 types of evaluation that are in the Precede-Proceed model. Process evaluation is when you look at the processes you're using. These are processes that are happening during the event. So for example, if you had we're running 2 sessions, one on the west side and one on the east side, and the west side had almost 100% participation and the east side had almost no participation, you would really need to stop and think about the processes that you're using to try to determine what is making one more effective than the other. Impact evaluation occurs immediately after something happens. So it could occur immediately after your grant ends. It could occur immediately following an education session. It could occur immediately following some type of health event that you have. Outcome evaluation is not something we'll typically do in this class or probably even in the program, because outcome evaluation occurs over a series of 5, 7, 10 years. So when you look at healthy people, that is actually looking at outcomes. And so they plan to have all these programs that have impact over 10 years to hopefully reach the outcomes that are set by the federal government and Centers for Disease Control. These are some other evaluation terms that you need to know. Formative evaluation, sometimes people use that in conjunction with process, even though they're slightly different. Formative is as you're forming something, how is it going? So if you're forming an activity, is it working? If you're forming a plan, is it working? Summative is after it's over, and it's very similar to impact or outcome evaluations. Qualitative evaluation are evaluations that do not have number associations. So if you ask someone which of the sessions did you enjoy the most, which strategy did you think is going to be most effective for you, those are qualitative. When you look at the primary data collection strategies that we talked about in Unit 2, almost all of those are qualitative. Quantitative occurs when you actually have numbers that are collected or assigned to something. So if you ask people to rank their attitudes 1 to 4, that's quantitative. If you give a knowledge exam, that's quantitative. If you count the number of people who attend a session, that's quantitative because you are working with numbers. Either qualitative or quantitative are good. They both give you data and they give you different types of data. Quantitative is a firm analysis, it's very concrete. Qualitative gives you a much more in-depth look at what people are thinking or feeling. So evaluations are basically determined by your objectives. If your objectives are SMART, the evaluation is easier to determine. That concludes the brief lecture. There are also activities that you should do in order to prepare for the assignments related to this unit.